name is Robina, and I'll be taking you break. And specifically, we are starting with preconception care. So when we are looking at preconception care, basically we are looking at that care that is a woman should undergo before she conceives. That's why we talk about the preconception. So this involves biomedical, behavioral, and the social health intervention before conception. The woman has to undergo counseling. There are tests that have to be done, and she also needs to be counseled on certain psychosocial uh, aspects and also her behaviors. So the aim is to improve health status and reduce factors that contribute to poor maternal and genital outcomes. Things like premature birth or the baby immediately after delivery or before delivery, then other complications that may end up resulting in the death of the mother. So most importantly, before conception, we look at reducing the mortality, preventing complications like I have mentioned, then some birth defects. We have seen some children who are born with some abnormalities. We shall look at some of them as we continue. Then infections and transmission of other complicated conditions like HIV or AIDS. So the importance of this, like I've mentioned, is to reduce maternal and child mortality, prevent unintended pregnancies that people get by chance can be prevented, then prevent complications during pregnancy and delivery, and also prevent stillbirth, preterm birth, low birth weight, and the birth defects. Another importance is also this kind of care lower the risk of type 2 diabetes and cardiovascular disease that can come later. Like some of these can be attributed to the too much weight that some mothers gain during pregnancy. And this, in most cases, can be because the mother does not have much knowledge on how she can control her nutrition during pregnancy. But if she gets the preconception care, then she can be able to manage her body. Important nutrition-related pre-pregnancy considerations. This include pre-pregnancy weight and BMI. Before the person conceives, it's very important for her to know the weight, and the BMI can be calculated from her height and the weight. This is very important because there's a specific weight that is expected to gain during pregnancy. And once the mother surpasses that, then it means that there's a problem. So she has to be advised accordingly. So when a woman is pregnant, we expect that she should not gain more than 12.5 kilograms. If it goes more than that, then there is a problem, and the health workers have to watch out. Another one is contraception and its impact on nutritional status. If the mother is using contraception, what is the impact of this contraception on the mother's nutritional status? There are others because contraception works in a way that it alerts the body that the woman is pregnant. So in most cases, the woman starts behaving. Those hormones make her to behave like she is pregnant. Others will make her eat a lot, and others will again take away the appetite. So these are some of the things that the mother really needs to be counseled on. Then also another aspect effect is the issue of recent pregnancy and the nutrient depletion. Take an example. Maybe the mother wants to conceive, but recently she had a pregnancy which she lost uh, prematurely. Let me say maybe she had an abortion. In most cases, if someone has an abortion, the person bleeds a lot and it can lead to anemia. So if someone is anemic, maybe mild or moderate anemia, then she conceives immediately, it can end up resulting into complications. So if something is realized like that, then the mother is counseled to know to properly feed before she can conceive. Then eating disorders and their effects on nutrient stores. Eating disorders like too much eating can lead to excessive gain of weight. Then also eating too little can lead to depletion on the nutritional or on the nutrients of the body. So this can lead to loss of weight. Let's look at specific nutrient needs for boosting fertility. So these needs include things like fiber, and the foods that contain fibers include oats, lentils, fruits, vegetables. Then magnesium, we can get it from kales, broccoli, spinach, almonds, lentils. So some of these here in our own setting, we are not so much used to them. But things like spinach, things like lentils, these ones we consume them every day, so we can be able to benefit from them even if we don't have the broccoli and the kales, the almonds. We can at least benefit from the locally available foods. Selenium, this we can get from onions, tomatoes, mushrooms, seafood, brown rice. So we have most of these, the onions, the tomatoes, the mushrooms, we have them, though they are not so common in our local setting here, but in other areas we can get them. Something that is very rare, I think, is the seafood, but at least we have the brown rice also. Then zinc, we can get zinc from this, chicken, fish, nuts, seeds, lentils. Then vitamin B6, we can get it from cabbage. This we consume it in most cases. Bananas, walnuts, pulses, eggs. So what is not so common, I think, is the walnuts that the rest of the other food sources we have them. Then vitamin E, we can get from nuts, we can get from blackberries, sunflower oil, also very important. Then our fats, we can get from omega-3 and omega-6 fatty acids from nuts. Then we can also get from seeds, and we can get from fish. So this we can be able to access them. Protein, we can get from chicken, we can get from fish, we can get from lentils, and the nuts on other seeds. So importance of folic acid. So when we talk about folic acid, it is something very, very important during pregnancy. For some ladies who have ever conceived, or men who have still had women who have conceived, well, a pregnant woman during the first trimester always given those yellow tablets. They're very tiny. They're the ones that contain folic acid. So as the pregnancy grows, she is weaned from those tiny yellow tablets. Then she can be given a combination of iron and the folic acid, which in most cases is a red color. So let's talk about the folic acid. Folic acid is very important, and its importance is to reduce the risk of neural tube defects. So one of the neural tube defects is the spinal bifida. And in most cases, when not taken, you'll find sometimes the mother can end up with having miscarriage. The pregnancy does not go until term comes out. Then another important is for red blood cell formation. Folic acid is also important for healthy cell growth. And the foods from which we get folic acid include the legumes, peas, grains, cereals, nuts, fruits, and the vegetables. So we have a number of those foods around us, but nevertheless, we still need the supplement. Supplementation is important as dietary intake. So right there we have a picture showing spinal bifida. So it is that kind of opening that occurs on the vertebral column. As you can see, those membranes that cover the column protrude out because of malformation. So this is what we call the spinal bifida. Iron. What is the importance of iron? Iron boosts stores before pregnancy to meet the needs of the fetus. So here we are talking about, when we talk about iron, we are now focusing so much on its importance of inflammation or increase in the blood. Basically, when we talk about iron, what comes into our mind is the red blood cells because they are composed of iron. Iron is very, very important in their formation. So the pregnant mother requires lots and lots of blood. That is why we encourage the mother to do well, and at the same time also she should get the supplements to make sure that her iron content is boosted. So non-vegetarian will require around 18 milligrams per day. Then the vegetarians will require about 30 milligrams per day. This is because most of the iron is contained in the animal sources of food, and the vegetarians do not eat these animal sources of food. That's why they are given bigger content of the iron supplements. So good sources include meat, poultry, fish, leafy greens, and the iron enriched grain. So factors that cause iron deficiency include low intake, like if the mother is not feeding well, then low availability, then parasites like worms that and that stay in most cases in the person's womb, I mean in the person's stomach, and end up eating up the nutrients. They end up sucking the blood and making the person anemic. Then other parasites like those that cause malaria, because in most cases they cause the red blood cells to rupture, they destroy them. So let's look at genetic counseling and testing. So genetic counseling and testing can provide valuable information about the risk of having child with certain genetic conditions. So we all know that each and every one of us is made up of a certain genetic component, which defines us. For you to be you, for someone to know that that is you, you have those unique things that are you, that make you up. But unfortunately, there are some conditions that are again linked, and these conditions in most cases can end up running in the family. Why? Because if your father has such genes that can be affected with that kind of diseases, he is going to produce you as a photocopy because you'll be containing 99.9% of the gene component of your father. And as a result, the kind of diseases that affected your dad will end up also affecting you. So that is why genetic counseling and testing is very, very important. If it is realized that there are certain kinds of diseases a discussion with a genetic counselor who can assess family family history and provide information about genetic risks and discuss available testing options. Genetic counseling can help individuals make healthy decisions and plan appropriate care. So managing chronic diseases, like I mentioned, there are some chronic diseases that can end up running in the family. So in case person is having some of those diseases, uh, what should the person do before conceiving? So chronic conditions like diabetes, hypertension, or thyroid disorders, it is crucial to manage them before pregnancy. They control the chronic diseases or conditions and increase the risk of complications during pregnancy and they have long-term effects on the health of both mother and the baby. Take an example for a mother who is having diabetes. In most cases, because there's a lot of sugars in circulation, a lot of sugars that have not been absorbed for storage or absorbed to be used by the body because of insufficiency of the insulin, the baby end up taking that too much sugar into its circulation at the end is absorbed. So you find that mothers who are diabetic have big babies to the extent that sometimes even they will not be able to push in one because the babies are too big and they grew too big because of too much sugar stuff in the body. So such conditions, the mother should be counseled on them and a proper plan is drawn to make sure that they manage their pregnancy. Then vaccinations. Vaccinations are an important part of preconception care. So there are certain vaccines that are supposed to be given before conception. Like for instance, we have the tetanus toxoid vaccine, which normally we give to even teenagers because it's very important to protect both the mother and also the fetus. So these vaccines, if the mother is planning to conceive, they has to get them. In our country, we don't give the MMR, but in other countries, like the European countries, they already give the MMR as part of the preconception care. This is a vaccine against the measles, mumps, and rubella. It's very important. But in our countries here, they have not yet started. So certain infections and pose risk to the developing fetus, so it is recommended to be up to date on vaccinations before pregnancy. Managing medications. Now, we should all note that it is very, very important to know that certain medications are not encouraged during pregnancy. There are those that are not encouraged in certain trimester, but there are those that are not encouraged throughout. Why? Because they have effects on the fetus and they may end up creating abnormalities that will last for lifetime. So it is good to review current medications before pregnancy. Some medications may cause risks in the developing fetus, while others may need to be adjusted or changed during. So assessing potential risks and exploring alternative medications or treatment options can help ensure a safe and healthy pregnancy. So some of these medications include Accutane, and the Accutane is a kind of drug that is used for severe acne treatment. Acne, I can talk like we can refer to pimples and we talk about that. So when you use Accutane during pregnancy, it can end up leading to miscarriage. You may end up losing the pregnancy. Then non-steroidal anti-inflammatory drugs. These drugs like ibuprofen, aspirin, naproxen. This one should be avoided during pregnancy, most especially the cardiopulmonary. This is because they lead to premature labor and the person may end up losing the baby prematurely uh, due to this. So once the mother is in her third trimester, we don't use this type of medication. But as for estrogen, we don't use it. Then SCE inhibitors and ARBs, these are harmful to fetal kidney and the cardiovascular system. So if the mother takes them during pregnancy, can lead to problem or can end up harming the kidneys of the baby and the child. Then we have warfarin. Warfarin is an anticoagulant which is used to prevent blood clots. People normally take it to prevent blood clots, more so people who have deep venous thrombosis or very those who have varicose veins. They may end up being prescribed this warfarin to make sure that the blood is not clot. So it can cause birth defects and bleeding problems, and it is generally not recommended during pregnancy. So if you're planning to conceive or your partner is planning to conceive, warfarin is one of the drugs to watch out for. Tetracycline. Tetracycline is an antibiotic that can affect fetal bone development and discolor the teeth. You have ever seen people with yellow teeth, teeth that have been tinted yellow, and even if they do what, that yellow color will never go. Why? Because likely their parents consumed this tetracycline and they were pregnant. So once this happens, it is for life. And in most cases, also the bones do not work well. So this is highly discouraged during pregnancy. And under the tetracyclines, we have other drugs like doxycycline, and there are others. So that whole group of tetracycline is not encouraged to be given to mothers during pregnancy. Then we have retinoids. These are medications containing high levels of vitamin A, such as certain acne treatments, and this should be avoided during pregnancy. Like I said, with the Accutane. Why? Because they lead to birth defects and they end up also leading to miscarriage. So talking about high levels of vitamin A, this reminds me during early pregnancy, like the first trimester, the mother is discouraged from eating a lot of liver because liver contains a lot of vitamin and end up leading to complication case of overconsumption. Methotrexate. Methotrexate is a drug that is used to treat certain autoimmune conditions. So we should also not use it because it can end up causing complication. Then lithium is used to treat bipolar disorder, which is a mental kind of illness, and it can increase the risk of heart defects in the fetus and should be avoided during pregnancy because it can end up causing more complications. Certain anti-epileptic drugs such as valproic acid and phenytoin can increase the risk of birth defects. So this should be taken with a lot of caution. If possible, should be changed. So if a mother comes to you, a woman who is hoping to conceive, this is the reason why when they are taking it, ask about whether the mother has certain chronic diseases, and one of them can be epilepsy that we asked about. This is because if she has that condition, then we ask which drugs she's taking. If he tells us he's taking this drug, then we advise that we have to consult with her doctor so that they are the drugs that she's taking so that the fetus is protected. Then hormonal medications that contain hormones such as some forms of contraception or fertility treatment. This, like for instance, contraception. In this case, if the woman is planning to conceive, then there is no need to have using the contraception. In most cases, they don't have much effect energy, but it will be like it's not important now because you are in need of conceiving. Then why they can prevent conception? Mental health and emotional well-being. So mental health and emotional well-being are essential aspects of preconception care. Why? Because our body, the way our body functions is determined by our psychological status. If we are psychologically stable, then our bodies will also function in a stable way. So addressing any existing mental health concerns such as anxiety and depression before pregnancy is important for the well-being of the mother and also the child that is in family. So now, if the mother has issues with the temper, has other emotional stress, she can be counseling to make sure that she manages accordingly to make sure that at least the pregnancy is not interrupted. Otherwise, she may end up with a miscarriage if it does not control the spread. Sexual health and contraception. Discussing sexual health and contraception is an essential part of preconception care. Ensure that you are using effective contraception until already conceived. So, when giving preconception care, we look at before this person conceived, how is she living, also sexually, and is she using any contraception to make sure that she plans her pregnancy well. It should not come like an accident. It should be something that is planned to make sure that the baby goes well. So we have to ensure that using effective contraception is very easy, kept until the mother pregnancy conceived. So there are some screening tests that we also do in preconception care. So these screening tests are recommended during preconception, and this is because there are some conditions that may be identified before the person conceives, and it is very necessary that they are treated before the person conceives to make sure that the baby is healthy. So such can be like sexually transmitted infection. Talk about things like syphilis, things like make sure that we yes, family planning and support. So we engage in open communication with the partner and the whole family to make sure that they are prepared for this baby that is going to conceive and brought into the world. So we encourage that the pregnant or the soon to be pregnant mother seeks for support from the family, the friends, and the groups of mothers who are also preparing to become pregnant to make sure that she is prepared enough to carry her pregnancy. So in other countries, there are prenatal classes or workshops that the mother can be able to join and they can arrange that. But in our African setting, it's very simple. You are orientated within your family because in most cases we live with extended family. So the women who have ever conceived before can give that kind of information to this new pregnant woman. So importance of partners in preconception care. Preconception care is not only for the woman, it has to involve also the partner. And most importantly, if there's any family member who is also willing to give support, it's very important also to involve such kind of family member. So we encourage, and that is why in most cases when women come to the health facility in search of such kind of services, we tend to ask them that you achieve. Why? Because this child, this baby that you are going to carry will require support from even the dad. Take an example. You're living with your partner, but your partner is a kind of a person who smokes and he smokes anytime and he feels like he has the right to. Remember when he smokes, you also indirectly passively. So this smoke that you inhale may end up affecting the lungs. This can be very, very dangerous. So these are some of the things that we talk about. We talk about this. We talk about in case the mother is having chronic condition. We also talk about it. We talk about what encourage the mother to quit the nutrition, not healthy for the baby. Drug use of illicit drugs is not healthy for the baby. Physical activity, we encourage that mother has to do some exercises to make sure that he, she stays well with the baby. And also to make sure that she does not overwork herself. She has to work in a way that her body is not overstressed to make sure that she at least um, maintains that good health for her. Stress management, like I talked about before, she has to ensure that she manages her stress and she doesn't allow any stress to go to her down. Stress can hurt fertility and pregnancy outcome. In most cases, if the mother is overstressed or if the woman is overstressed because she conceives, it's very rare. If she conceives but she is still stressed, then there are high chances of her losing the environmental factors like environmental chemicals, toxins, and pollutants. If she's living in an environment that is highly toxic, then she can be encouraged to move away from that environment. So, as for today, as for our introduction, this marks the end of the lecture. Thank you so much for being part of this lecture.